Histamine, have you heard of this? Is it a neurotransmitter? Neuromodulator? Which system it is involved? More commonly. Yes? Have you heard of this anaphylactic shock? Have anyone got bee sting? Honey bee stings, allergic reactions to any contact, maybe some plants, pathogen, sneezing after going for dust. Yes? How do you think all these reactions are mediated? The main ingredient is, the main agent which can reduce all these things is histamine. Drug reaction to penicillin, which is the main mediator? Which is the drug of choice for anaphylactic shock? Yes? Yes? I have some different names also. If adrenaline is the drug of choice, what you want to prevent that? It is used against histamine. Okay, so the physiologic antagonist within the body and can be used from the external sources, that is adrenaline. Okay, so today we are learning about the histamine. Okay, it's a biological amine. You can see trivial reaction may be starting with small triple reactions such as B-Anti reaction to as graded as anaphylactic shock. All these reactions are due to the release of histamine from the mast cell granules or from the other stored granules of histamine. So histamine, have you heard of the person Day? Day's phosphomolar reversal. What is it? Okay, so I assume that you know this. Okay, Henry Day and Patrick Taylor, they have started using this histamine and they identified this as a biological amine and the properties associated with it. So biologically it is histose from the tissue and with an amine. So where is it found, histamine? It is primarily from the mast cells. Okay, it is a physiologically active amine found in both plants and animal tissues. And in humans, we have it in most of the parts being in CNS, GIT, respiratory system. All these systems have the different types of histamine receptors, starting from H1 to H4. Okay, so in the blood vessels, there is vasodilatation of the capillaries, something similar to the serotonin. Okay, there was vasodilatation, constriction of the bronchial with smooth muscle, and also increase in the secretion will be there. This decrease in the blood pressure will be due to the increase in the vascular volume. So vasodilatation may be leading to what happens with vasodilation is that there is decreased blood pressure. Okay, so this can lead to reflex tachycardia. Okay, so this is the ring imidazole group. So it is formed from the amino acid histidine, okay, by the help of the enzyme histidine decarboxylase. So it primarily occurs in the basophils and the mast cells. So how this histamine is released from this mast cells? Okay, here we can see that there are in green color, these are the allergens, okay, maybe in the form of IgE. They come and attach to this receptors on the mast cells. Once these receptors are attacking there, what can happen? There can be series of chemical reactions taking place leading to degranulation. Once degranulation is taking place, there is release of both ATPs and this histamine. So once this histamine is released, it can go and act on the blood vascular receptors. Once they act on these receptors, there can be vasodilatation, which can lead to wheel and tear reaction. If there is a massive reaction or a repeated allergic reaction which is already having a memory in the body, and that reaction can be dreaded, leading to anaphylactic shock. So it is released by decarboxylation of this histidine, okay, and it can be quickly inactivated by histamine N methyltransferase and deaminase. So this quick deamination is also important. If it is not metabolized faster, anything for the matter in the body, for example acetylcholine or any other neurotransmitter, they have very short lifespans. Okay, so they have this pulsatile release also, and this is a biological regulatory mechanism. Okay, so you know that if there is excess release or the concentration increases at the site, it will lead to problems. Mainly the stimulation is by IgE mediated antibodies. So allergic reaction, we can classify them into early phase reaction and late phase reactions. Okay, so here you can see, first there is initial contact with the allergen, then the activation of the plasma cells, release of the IgE antibodies. Okay, once IgE antibodies are released, they attach themselves to the specific IgE receptors, then there is histamine release. In early phase reaction, it occurs in about 30 to 90 minutes. Late phase reactions, it begins in most of the chronic diseases, maybe like 4 to 8 hours. And it can lead to chronic inflammatory diseases. Can you remember some of the diseases where we use this antihistamines? Chronic inflammatory diseases, asthma, atopic dermatitis, any other skin conditions. So what are the agents which can cause this IgE-mediated reactions? Okay, early or the late phase reactions. What may be the common allergens? Okay, so as you can guess, it may be the plant products, maybe contact with the plant poisons, pollens usually due to inhalation. Okay, so latex or any other substances which can cause allergy. Anything under the sun, like any chemicals, most of them can cause this allergic reactions. These things, what does it release? And anti-formic acid. These things is acetic acid. So what we do when there is a B-spin site, there is wheel and tear reaction. We can apply this base. What bases are commonly available with us? Yeah. Have soaps? What are those? Common daily what you use? Soaps, soft soaps. Okay, these soft soaps can be applied to the local area so that the symptoms can decrease or they can be partial balancing. Okay, something like acid plus base giving rise to salt and water. Okay. Then ingestion, medications. Yes, I think by this time you know some medications which can cause allergy. Mainly, it may be sulfonamides or penicillin group of medications. So sometimes peanut, shellfish, okay, some fishes, all these things can cause allergy. Inhalation, dust, mold, dander, okay, all these things. Maybe this molds, you know, it is a fungal particles. These can also lead to allergic pneumonia. Okay. So here you can see the, in case of allergic rhinitis, the inflamed turbinates, okay, superior, inferior, and posterior. All the turbinates, there are inflammations. So in case of this penicillin, what we do, we write it in front of this penicillin injection as APT, after test dose. So how do we test this? We test them with the help of which type of injection? How much we can give? Test. We give 0.1 ml intradermal. Okay. So if you have the reaction such as like after the site of the reaction or the site of the injection, we put a circle around about the radius of 1 centimeter. We see that if there is reaction and the possibility of reaction is there, we can see the hives there or any of the redness, critical pneumonitis, all these things can be seen if there is. So other than this regular what we come across day-to-day activities, we can release histamine. We do also have some of the chemicals which can release the histamine. Okay, these are morphine, these are opioid analgesic, D2-butyrate, skeletal muscle relaxant, trimethophan, these are sequential blocker used along with the sulfonamides. Okay, polymyxin. It's a powerful antibiotic, more toxic agent used for this. Even though it is used orally, it is not absorbed, less absorbed, and a toxic agent which is used very rarely and as a reserve drug. Dextran, plasma expander, detergents, substance P, bradykinin, and redocontrast media. Sometimes they can cause allergic reaction. The drugs which can inhibit the release of the histamine. Okay, adrenaline, ephedrine. You know adrenaline is a physiological antagonist. Ephedrine, isoproterenol, mast cell stabilizers like disodium promoglycate, ketotropin. Where these are used? Mast cell stabilizers. They find them used in asthma. So and also by negative feedback control, the histamine release can be inhibited. So the clinical features, it can last from a few minutes to few hours. Okay. So mild reaction, moderate reaction, and severe anaphylactic reactions are seen. Starting with erythema, urticaria, itching. Okay, it is the basic symptom found in almost all three conditions. In moderate, there can be the respiratory distress and hypertension. In severe, it can be this hypertension can lead to ventricular fibrillations, cardiac arrest, bronchospasm, and death. So that's why the detail for treatment of any patient starts with ABC. So that is, if the bronchospasm is there, the patient cannot breathe, we cannot save the patient. Okay. So intubation is very important because the person is there within our setup at the right time, we can do all these things. So coming to the receptors, where this histamine receptors are present. Okay. So type, location, function. So though there are 4 receptors, H1, H2, H3 and H4. H2 will be learning in the GAD part. So today we'll be concentrating more on the H1 receptors. Okay. So H1 receptors, we can see that it is present in the smooth muscles. Okay, in the smooth muscles, what we can do? It can cause the contraction of the ileum and also the uterus. Okay, so this spasmodic contraction of the ileum, what can happen? If the drug is in excess or ingested unknowingly, what can happen? There can be diarrhea. So exocrine glands, pancreas, salivary, lacrimal glands, all these secretions can be increased. That means there can be increased insulin release, excess salivation and lacrimation. So in the under the endothelium, there can be vasodilatation action. CNS, it is also considered as an important mediator for pain and itch. Serious, we told that on the blood vessels, it can cause vasodilation, can lead to hypertension, can cause reflex, bradycardia due to the stimulation of the chemoregulators. Then coming to the respiratory system, it can lead to bronchoconstriction, bronchial sphincter contraction, okay, eyes, pain, itching, all these things are there. So it also finds its role in rhinitis and motion sickness. So drug of choice for motion sickness? Arsine? So H2 is a class. We will be learning this in GIP. They are primarily present in this parietal cells. Okay. So they stimulate the gastric acid secretion. That's why we use this antihistamines, ranitidine, cimetidine, famotidine for treatment of this acidity. Anyone take on these drugs? Ranitidine, Rantac? Yes. So H3 receptors, they are found in the central nervous system and they cause decreased neurotransmitter release, okay, such as acetylcholine, norepinephrine and serotonin. Here you can see the agonistic and antagonistic action, where in case of this serotonergic receptors we also saw the agonist, the receptor action may be like decreasing the effect. Okay. So we need to be taking care. Such receptors are seen commonly in our CNS. Here you can see we can really decrease the neurotransmitter release, histamine, acetylcholine, norepinephrine and serotonin. So H4 receptors, they play a role in chemotaxis. They are primarily found in the basophils, thymus, small intestine, spleen. Coming to the agonist and antagonist at each side. Okay, so basically we need to know the agonistic action is by histamine and all the receptors, and the drugs we are having are the artificial ones. Okay, so agonist at H1 histoprotein, H2 diamoprate, H3 methylhistamine, H4 clozapine. Have you heard of this clozapine? It is a atypical antipsychotic acting at antipsychotics act at dopamine receptors, but this drug is the atypical one with lesser side effects acting at serotonergic receptors. It also has its action on dopamine receptors, but more so on the serotonergic receptors. So here is one entrance question. Okay, during my mind, it is a drug now tried on the animals, like it is in the preclinical stage, and it is found to have analgesic effects. Okay. So H1 antihistamines, we have this generation of the drug which we learned in the later slide. H2 antagonists, we have ranitidine, famotidine, H3 terperamide and H4 same terperamide. So this H3 and H4 antagonists, they are still to find their pharmacological use, but the effects are tragic. So antihistamines, how they act? Antihistamines, they are the agents which can inhibit the action of histamine by blocking its attachment to the histamine receptor, something like competitive inhibition, or by inhibiting the enzymatic conversion of histidine to histamine. Okay, by blocking the enzyme histidine decarboxylase. So we have two generations of the drugs. Okay, the first generation of the drugs which have the antihistaminic action, anticholinergic action, and some associated side effects, and the second generation drug which are more particular to antihistaminic action and lesser side effects. Lesser side effects, lesser users. First generation drugs, more side effects, varied users. Okay. So how is it so? We will be learning it now. So first generation highly sedative drugs, we have this doxylamine, hydroxyzine, promethazine. Okay, so dimenhydrinate, diphenhydramine. Have you seen this in any combination syrups? Diphenhydramine, dimenhydrinate, they form the part of this cough syrups. And doxylamine, it is the safe antiemetic in hyperemesis gravidarum. So, what is it? Hyperemesis gravidarum? Pregnancy-induced vomiting. More common in the first trimester of pregnancies. Okay. Then hydroxyzine, it is tried in this atopic dermatitis. Okay. It is usually used at the night. Promethazine, it is used in post-operative conditions to decrease the emesis. Moderately sedative, we have this clemastine, cyproheptadine, pheniramine. Cyproheptadine, antiseptic, antihistaminic, used in induce the appetite. Okay. So pheniramine and chlorpheniramine. Pheniramine is moderately sedative. Chlorpheniramine is mildly sedative. CPN tablets, which they are used in comes together in government hospitals. There are only few drugs which are available in our government hospitals. Okay. So mild sedative, we have this cyclizine and betahistine. So betahistine, do you remember where we use it? It is tried in migraine. Cyclizine, again it is a drug which is used to induce the appetite, and it is told that it can increase the height of the person also. So it comes with the trade name of longifying. So second generation drugs, they have lesser side effects, okay, and they are more particular, something like going on a straight path. Okay, terfenadine, astamizole. Terfenadine is less used now because of its adverse effects related to cardiovascular system. Cetirizine and levocetirizine, most commonly used drug. Loratadine, desloratadine are the newer group of drugs, and desloratadine is known to decrease the inflammation risk not only by blocking the histamine receptors, by other mechanisms also. Fexofenadine and avastin, they are the drugs which are used sparingly, okay, but these other instruments are not that much effective. So the treatment of this skin infections is most of the time by topical agents such as this calamine lotion or some steroid. But overall, most of the time, they need to depend on this antihistamine. They are something like they are a primary group of drugs which are used in the skin department. So you know that this relative presence of this receptors. For example, we just follow the where these receptors were present. H1, H2, H3, H4. It is not so that they are only present in those areas. They are highly concentrated in those areas, but it is also possible that the other receptors were also present there, but their concentration was less. Okay, so that means second generation drugs are effective. Second generation drugs are effective, but more so the first generation drugs will be more effective. But like for the person is having lot of allergic reaction, it is uncontrolled, we go for first generation and the second generation. Something like cetirizine in the morning, CPM or hydroxyzine in the night time. Okay. So with side effects, the advantage is also there because they are not particularly blocking the H1 receptor only. They have this spectrum of action on certain receptors, cholinergic receptors, and also the H2 receptors. Okay. So the combination of H1 first generation, second generation is also tried when the patient is unresponsive to the single drug. So antihistaminics, where can we use and what properties we can make use of them? Sedation, yes. Sedation means it is first generation drugs starting with CPM, okay, hydroxyzine, all these drugs are used as a sleep aids. Baby with cold or cold, what will happen? The patient he can only cry, okay, and it is one of the mechanisms like to soften that or the patient parental apprehension is there, okay, baby is not sleeping, it's crying, and it will be the same with the middle-aged people also. Like I'm not getting relief from this, what is happening? I'm not getting relief from this cold. That symptom is there. And in most of the apprehensive patients, we can go for the CPM combination or the chlorpheniramine maleate combinations, where the person can get elevated or we can alter his consciousness about that condition, okay, making him sleep. So anti-nausea and anti-emetic effect, we discussed that anti-emetic effect it is by promethazine and doxylamine. Okay, doxylamine it is safer among the pregnant women. Anti-Parkinsonian effect by diphenhydramine. Okay, it suppresses the extrapyramidal effects associated with antipsychotic effects. So antipsychotic drugs after a long time, what they can induce? Parkinsonism. Okay. So antipsychotic drugs after a long time they can induce the Parkinsonism due to the extrapyramidal side effects. Okay. In such conditions, you can go for this drug. Anticholinergic action by ethanolamine, ethylene diamine. These are not discussed in the list which we had, but just for understanding for academic purpose, these drugs can have this anticholinergic action also belonging to the antihistaminic group. So they can be helpful in non-allergic rhinovirus. So alpha adrenal receptor blocking action by promethazine, okay. Sertraline blocking action by first generation drug, that is cyproheptadine. Local anesthetic action, they are found to be more effective, more active than the regular local anesthetic such as procaine. And other actions such as terfenadine, acrevastine, they can inhibit the P-glycoprotein. Still the use is to be found out. P-glycoprotein is a drug which is a transport, something like a transporter which can be beneficial or be bad. In cases of this tuberculosis, it helps the drug to be thrown out of the cell, so it is bad, having bad effect. Sometimes we use this P-glycoprotein blockers so that the drug can stay there. Okay, so this actions, other actions, action on this P-glycoprotein is to be found. How they can be made helpful. And this transporter is found at cancer cells, gut and brain. A little bit about pharmacokinetics. Okay, so first drug we have found with the first generation is hydroxyzine. From that we have cetirizine, then duocetirizine. It is more effective. Okay, higher, more receptor affinity, selectivity, and efficacy. Terfenadine, it was I told it has some cardiovascular side effects. Now we have hexafenadine. It is better than that. Cardiotoxicity is still there, but it is better. Loratadine, from loratadine we got this desloratadine, okay, lower the drug-drug interaction, and I also told that this desloratadine can decrease the histamine release other than by blocking the histamine receptors. And we need to remember this antihistamines are well tolerated drug. Okay, like 3 times the dose, 4 times the dose may not cause that much problems to the patient. For example, like cetirizine, we use it at 10 mg. Sometimes they are used 2 times daily, 20 mg, 30 mg, like that. And duocetirizine is used at the dose of 5 mg, usually once a day. and the second generation drugs are more longer acting. Okay, compared to the first generation, we have the second generation drug which are longer acting. So tafenadine, acetaminophen, removed from the market. Chlorpheniramine, hydroxyzine, loratadine, they're still in the market. These are the most commonly used drugs now. Cetirizine, though used, but leocetirizine has made a way. So where can we use this drug? In one of the slides I showed the slide where conjunctivitis was there. So topical antihistamine preparation doses are also there. Okay, topical anesthetics are also there. You can have this local reaction prevention. In case of conjunctivitis, they can be helpful. So common uses: allergic rhinitis, allergic conjunctivitis, dermatological conditions, atopic dermatitis, contact dermatitis, name it, any type of dermatitis we can have there. Use urticaria or hives, angioedema, swelling of the skin. Do you remember some drugs causing the angioedema? AC inhibitors, pruritus, atopic dermatitis, insect bites, and finally anaphylactic reactions. We can use this drugs. Anti-inflammation, we can use this adrenaline and also other steroids, sometimes they are used, and these are supplementary fluid. Okay. So coming to the adverse drug reactions. Okay. So what reactions we can get? Okay. Anticholinergic, CNS